good afternoon, and welcome to Moments with Pastor E. This is Pastor E from the lovely city of Randolph, Massachusetts, coming to you this evening. I'm delighted always to come into your homes, wherever you are, in your car, wherever you find yourself. I just love coming here on a Saturday afternoon. We just thank God for the wonderful weather, because, you know, of course, I have to give you the weather when I come on. It's so beautiful here in Boston. It's a great time of year. Hopefully we don't get too cold again, but we'll enjoy whatever comes. Because I always quote that scripture, the heavens declare the glory of God, and the firmaments showeth his handiwork, and the snow, the rain, everything is his handiwork. So we just give God thanks. Father, we thank you for this opportunity. We thank you for blessing us. We thank you for this time of sharing. We just commit everything into your hands in Jesus' name. Amen. Well, this afternoon, I am so honored to have with me in the studio two wonderful, wonderful ladies. I have Dr. Simone Wiles and Dr. Donna M. Bright. I am first of all going to give them a minute just to introduce themselves. And once they've done that, I will read you their bio. I mean, they have just sent me a snippet of what they do in life. So you will get to know them real well by the time the program is over. So Dr. Wiles, you want to go first?
Hi, everyone. My name is Simone Wiles. I'm an infectious disease physician at South Shore Health in Weymouth, Massachusetts. And I'm also affiliated with Tufts Medical Center.
Thank you. Dr. Donna.
Hello, everyone. This is Donna Bright. I am a public health practitioner, and I look forward to talking a lot today about COVID-19. And thank you so much, Pastor E, for having us here today.
Oh, absolutely. It's my absolute pleasure. I feel very honored to be sitting in the seat here with you wonderful ladies. Thank you for accepting the invitation to come on. I know how your lives are busy, and you could have been any place else doing what you do, but you chose to be here. And so for that, I thank you. And I know that this is going to be educational, it's going to be inspirational, and people are going to walk away with a lot of knowledge this evening. So before I do anything else, let me just read your bio. So Dr. Simone Wiles received her bachelor's degree from Barry University. She earned her medical degree from Lima Linda University. She completed an internship, residency, and fellowship in infectious disease at Hahnemann University Hospital. Dr. Wiles is currently working as an infectious disease physician at South Shore Health for the last 15 years. She is a clinical assistant professor of medicine at Tufts Medical Center. Dr. Wiles is actively involved with the Mass Medical Society as executive board member, chair of the Committee on Diversity, vice chair on Committee on Public Health, and presidential COVID-19 advisory group. She is involved with Massachusetts Department of Public Health Equity Advisory Group. Dr. Wiles is a member of Infectious Disease Society of America and American College of Physicians. She is also an ABC medical contributor. Dr. Wiles served as the health director for her local church in Boston and was involved with Faith-Based Cancer Network in Boston. So as you can tell, in her short life, she has done a lot. Yes. So thank you, Dr. Wiles, for being here. Dr. Donna Bright. Donna spent over 25 years of her profession in public health, designing, developing, and evaluating health promotion and capacity building programs, and improving the quality of healthcare services. Donna holds a PhD in health services research from Brandeis University Heller School for Social Policy and Management, and a Master of Science in Health Policy from Harvard School of Public Health. Currently, she's a consultant for Massachusetts Department of Public Health and project director of Organizing for Health and Wealth, an initiative of the BMA 10-point, which aims to address vaccine hesitancy in the Black community. Need I say anything else about these two ladies? So, as you can tell, this is going to be a discussion around COVID-19, around vaccines. And for those of you who have not been educated yet, and I can't imagine anybody out there not being educated after almost 2 years, you will leave this program very well equipped. So, Dr. Wiles, I am going to start with you. Now, people have lots and lots of questions around wearing or not wearing masks. What are your thoughts?
Dr. E, just want to thank you again for having me and being here to be able to share information with all the members of your church and others that might be listening. Masks are a hot topic these days.
Yes.
Everywhere I go, everyone wants to know, what do you do about masks? You know, I tell people, I understand that people are genuinely interested in getting rid of masks. We've been wearing masks for about 2 years. I think now that things are looking better, it really is time for us to revisit that. And what do you know, let me explain what I say, things are looking better. The most recent data shows that our hospitalizations have decreased. That means not as many patients in the hospital. We have a significant number of individuals, especially here in Massachusetts, that have been vaccinated. Another tool that we've been using is our wastewater numbers for COVID is down. Yeah. And our positivity rate is also down. You know, when you think about just a few weeks ago in January, it was significantly higher. The latest number is like, you know, almost 3%, which is really very low. I think using those metrics will be able to help us to say, you know, we might be able to take the mask off. However, I want to stress that as we have seen with a lot of the different variants and what happens, we have to be able to come back to mask if we need to. But I think right now, if those numbers are looking good in your community, I think it's reasonable for you to go ahead and take your mask off. The only thing I will say, if you have underlying conditions, if you're immunocompromised, you're still not comfortable taking your mask off, you go ahead and wear your mask. It's perfectly fine.
That sounds good. And I work in healthcare, and we were really bummed when we heard all these places that can take their mask off, except in healthcare, we have to continue wearing our mask. But for me, like I just mentioned to you guys before we came on, I had COVID-19 in the very early stages when we were kind of groping in the dark there. We weren't sure what the treatment should be and what exactly this thing was. And so for me, it's a security blanket for me. I don't leave my house unless I'm wearing a mask. If I go to the store, I have my mask on. I'm at work, it's mandatory at work. But I just feel unsafe, and that's just me, you know. And I know, like you said, people are weary. People are tired of this thing. I'm tired with it too. But I feel like I'm safer when I go out in public, in a store, in a restaurant, whatever, that I have my mask on. So, you know.
Pastor E, I think it's really fine if you want to continue wearing your mask. You will get to the point where you feel a little more comfortable to take the mask off. I think right now, wear your mask. Wear your mask. There's
Yeah.
nothing wrong with wearing your mask. It's just for those who want the freedom.
The freedom.
Of getting the mask off.
Yeah.
They can absolutely do it, provided the numbers are good in your particular town or the particular group meeting or individuals that you're interacting with.
Great. One thing I wanted to ask you, because we've seen that, you know, the positivity rate has gone down. We've seen, you know, hospitalization, the numbers have gone down. But what I struggle with a little bit, and I think other people do, is the number of deaths. We're still seeing a high number of people dying every day. So how does that work in that equation?
Of course, death is always a concerning factor whenever we look at the impact of COVID.
Yes.
I will say that the deaths have decreased,
Okay.
but you know, it's still not where we want it to be.
Right.
But the numbers, just as the hospitalizations have been going down, so has the number of deaths. So of course you want 0 deaths. We're not there yet, which is why we want to encourage people to still be vigilant, you know, in terms of what you're doing. If you don't feel well, stay home. If you have underlying conditions and you're very ill, make sure you contact your healthcare provider. Do all the necessary things you can to protect yourself. And most important, want to encourage everyone, because there's a large number yet that haven't been vaccinated, get vaccinated and boosted if you haven't done so yet.
All right, and we're going to come back to that.
And I'll just add about the deaths. There have been in Massachusetts a total of around 23,000 people that have died from COVID-19. And, you know, we just, and I think some statistics have said about 1/3 of those deaths were preventable because of, you know, because we have life-saving and preventative vaccines now that we can use. But not everyone is vaccinated, obviously. Massachusetts has done a great job with vaccination rates, but it's a mixed bag depending on what county you're in or what neighborhood you're in and your race and ethnicity. There's a lot of disparity and diversity across race. So let me just say that, you know, currently, I think, let's see, I had some stats here I wanted to share that even though Blacks make up a little over 7% of the population in Massachusetts, Black people account for almost 23% of the deaths. So there's the disparity there in deaths, but then also even downstream with, you know, hospitalizations and cases and severe illness. Black people are definitely disproportionately impacted, and we know this, and there is a need to do a lot more. We're not quite over yet. In fact, in terms of vaccination rates, in Boston, which is the area that my program focuses on, targeting Black people in Boston, 60% of Black people in Boston are fully vaccinated.
Wow, that's great.
That is good, and it's been ticking up slowly but surely over months and months and months. It's but at the same time, 65% of white people in Boston are vaccinated. So there's a little disparity there. And 38% of Black people, Black residents in Massachusetts overall have received a booster shot. So that's an area where we still need, there's still a lot of work that we need to do to get those first and second shots, as well as boosters, and for some immunocompromised individuals, there is talk of the fourth shot that maybe Dr. Wilds can speak to a little bit more. Yeah.
So Dr. Donna, you and I met through a mutual friend.
Yeah.
And this was based on the fact that you're doing this work in our community. So can you talk a little bit about this BMA 10 point, you know, what exactly are you doing in the community? I know a little bit about what you do, but
Sure.
folks out there would love to know what you're doing. As a matter of fact, we had kind of collaborated to do a clinic in Mattapan, but the space was just not adequate. So that didn't happen, but your work still continues. So
yes.
that.
So, you know, a year ago, when we were all locked down and I was just kind of sitting around in my living room, I decided I was trying to think of how I could get involved in the vaccine space, because we had these vaccines that were just coming out. And although I had stepped away from public health, I felt so burdened and compelled to try to utilize my expertise and skills and in relationships to see what we could do to get the Black church involved in the public health space, because it was very clear to me and many other public health practitioners that this issue of hesitancy in the Black community had a lot to do with mistrust of the government, mistrust of the science of the vaccines and how fast the vaccines came into production and into use. And so I approached the Department of Public Health, but also the BMA 10 point, because as a leader in the community, the BMA has been in organizing churches and providing support services for churches for over 50 years and doing a lot of programming, some public health and social programming and education programming in the community for a long time. So they have deep roots in the community and relationships. And so Reverend Wright, who is the executive director of BMA 10 Point, agreed to collaborate with me. And I approached the Department of Public Health that was also very supportive of engaging the Black church in this work. There's not a lot of deep-rooted examples in Massachusetts of faith-based public health partnerships and work. There are a lot of great isolated efforts even before COVID, but we really, since COVID, a lot more has been happening. Church leaders stepped up to get involved, do what was necessary to reach their members and larger community to address COVID-19. So this project, Organizing for Health and Wealth, really aims to address hesitancy, but also increase access to vaccines. And we do that by partnering churches, Black churches, with community health centers, the two most trusted entities in the Black community, coming together to provide vaccines or vaccinations within churches. So helping to increase access to the vaccines, but also in a trusted space. And so we've had some pop-up clinics and other even stand-up clinics, if you want to think about some of the ongoing clinics we had at Bethel AME Church and at Holy Tabernacle Church over several months ago. And now we're doing a lot more just pop-ups to kind of one-day events in the churches. But another big piece of what we've done, which has just been critical, is the education piece. Getting the facts out there, dismantling the rumors and the misinformation. And so we tapped into church members and other community members to form a what we call a faith-based public health corps. And they, several individuals have participated in this corps, where we have weekly education meetings where, and we train these individuals to stay abreast of the facts, which seem to change weekly, or and they have been charged with reaching into their social networks, their family members, their friends, their neighbors, their co-workers, other church members, to spread the facts about COVID-19 and the vaccines in particular, as well as to help their networks to be able to access the vaccines, where to go, how, to get a vaccine. So we've also done some social media stuff as well, targeting millennials, because, it was, we really need to get our young people vaccinated, even though they, think they're invincible.
They're a tough group.
They have been a tough group, but even those vaccination rates among the 20 to 30-year-olds are going up slowly but surely now. So, but yeah, so that's what we've been doing. I mean, I could talk more and more about it. I'm really passionate about trying to develop sustained relationships between Black churches and community health centers so that we can keep the Black church engaged in this public health work, which they're just so well suited for, because they, have access to the populations, they have a heart for ministry, and I've always been a big proponent of making sure we get the resources to the churches to do this work, and the Department of Public Health has been quite supportive of that, as well as I mentioned earlier, the CDC Foundation, which is supporting organizing for health and wealth.
That's awesome. Awesome. Keep up that good work.
Thank you.
We need all the education we can get, because like you said, there is so much misinformation out there. It's just crazy. I mean, some of the stuff is wild. Like,
it really is.
The government just wants to track me down. And I said to folks all the time, I said, listen, if you have a social security number in this America, the government can find you.
Oh, yeah.
They don't need a vaccination to find you. Dr. Wiles, you've been very patient there. Look at you. You're just sitting over there waiting to just give us some more stuff. Now, I want you to talk about the vaccination hesitancy. I mean, there's so many people that we meet on a regular basis that for some of them, had it not been that they would have lost employment, they would never have gotten the vaccination. At work, when we started the whole vaccination process, for months, we had about 50 people who would not budge. But when it came to the fact that it's either you're going to be employed or you're not going to be employed, people reluctantly got the vaccination. So I want you to talk about that, and also the booster hesitancy too, because that is a big deal. So some folks get the vaccination, but when it comes to the booster, they won't get it. So tell us what you think.
So first I'll say, how much time do you have? Because
go ahead.
Bottom line, it's a really complicated problem, which needs a lot of time to address, why, especially in the communities of color, there's so much hesitancy. We could go back to history, and some people tend to refer to what happened with the Tuskegee trial. Other people bring up Henrietta Lacks. I mean, there's many different pockets that have different sources of information. The way I personally approach it is I try to develop relationships. I try to listen to the patients and listen to their stories, because I don't want to dismiss, because there's some real concerns that I am hoping that I can walk them through the facts that are available and present it in a way that it makes sense. I can answer all their questions. I can, talk about the benefits of it, talk about the research associated with it, talk about the impact not only on yourself, but other members of the family, why we're getting this, and also remind them that, it's not an individual illness that we're dealing with. We have a pandemic. So what I do affects you. And so we have to work together, take care of each other, just like in church, you say, I am my brother's keeper. I think with COVID, this is really important to stress why that is important to get vaccinated and boosted. And again, it's not even only here in the US, but other parts of the world. You know, other countries who don't have as much resources, they need vaccines too, because we're going to travel to their countries. We end up with COVID. I mean, really, it's a global issue. So, you know, bottom line is I try to just meet those that are hesitant, and it's very difficult. Some people are like, it doesn't matter what happens, I'm not getting it. And, you know, my stance is I respect your decision. My role is to give you the information so you can have all the information to make the best choice for you, right? And I can feel comfortable saying I did my due diligence in covering all the bases. I will say that, you know, people have also said, okay, we have had 2 shots, or for those who have had the J&J 1 shot, we're not getting the booster shot. And again, another layer where more education as to why it's important to get the other shot. I always say it's about saving lives. It's about preventing hospitalizations. I come at it from the perspective where I see patients dying every day from COVID in the midst of the surge, and even now. And I've had people who have not been vaccinated who said, can you give me the vaccine now? And unfortunately, that's a little too late. So I try to do preventive care to help them to do what's best for themselves and their families and their grandparents. You know, it really is a family affair when we talk about vaccines and boosters. And the more people I can get to talk and listen and have open dialogue really helps to build that trust, because I'm not talking from, you know, 10,000 foot level. I'm in the trenches with them.
And, you know, and family, I'm sorry.
Go ahead, Donna.
You know, family members and friends, they are the most influential messengers, as well as doctors, for sure, that we found that, and that's why the outreach workers that I work with, sometimes, you know, they'll go back to the same person because they have a relationship with it. Maybe it's their cousin, their aunt, and they go back to them several times over time. And it's so exciting when then they jump on the weekly training call and they say, so-and-so finally got vaccinated. It's very exciting, but it does take a lot of time, and it does help to get messages from those trusted messengers. But there's still a lot of hesitancy around trusting the vaccines, trusting the government. And then some people are just, you're not gonna be able to change their mind.
No.
Yeah.
You know, I have a young man that I've talked to until I think my face is purple now. And he's a really good friend of mine, and, you know, I consider him family, but he's not budging. So I have just stopped. I say, you know what? Like Dr. Wiles was saying, you know, you have relationships with these people, but if they're not going to do it, they're just not going to do it. So, you know, what do you do then?
Well, you encourage them to mask. And I do find that, because I have family members who are not, you know, vaccinated, but they will take all of the precautions. Yeah. So wearing masks is still such a great tool for keeping you safe. Yeah. I don't know. I mean, other than, you know, masking, then you just have to pray for them.
Pray for them. That's all it is. Just pray for them that they come around one of these days.
Yeah.
And, you know, some of them have had COVID, and it still doesn't matter. They're just not, I'm not doing it. I don't want that foreign thing in my body. I'm like, okay, you know. So Dr. Wiles, where are we? I know you can't make any predictions, but I've heard so many stories. Are we getting close to the end? Are we in the middle? Where are we in the age of the pandemic? Where are we?
Yeah, that's what I want to know.
That's a great question. And every day I have a number of people asking me that question. And you know, you never have the perfect answer,
right.
But based on the information that I have, I will say, coming off of the Omicron surge, things are absolutely a lot better. We are not there yet, but definitely moving closer to the end point. But I will say, there will be other variants. There will be other things that just happen. Yeah. But I think we're in a better place. And that's what I want to stress. We're in a better place in terms of managing the pandemic. We have more treatment options. We have more vaccines. We have more boosters. The healthcare team are more experienced in terms of what to anticipate with these patients. So I think our tools that we have available are a lot better. It's not, you know, completely scary in terms of what we're dealing with. And right now, the fact that we have a larger percentage of individuals who have had COVID, there's a lot more people that are immune than we were 2 years ago. So I think we're getting closer to the end, but it doesn't mean we need to rush forward to our quote unquote normal, or that might not be what we're accustomed to right away. But I think gradually we're seeing that we're peeling off the layers. Like, you know, classic example, we're starting to take the mask off. Mm-hmm. So, you know, gradually we're getting closer to that end point, but not quite there yet.
Okay. Now, what are they, I know, you know, they were doing some studies around younger children getting the vaccine. And I was pretty hopeful because I have a 4-year-old granddaughter and she's the only one in the house that's not vaccinated. Mm-hmm. So I was very, very hopeful. Where do we stand with that these days?
Before I answer that question, Pastor, I wanted just to just piggyback on one thing that Dr. Bright said with regards to the vaccination rates. She talked about, you know, the rates in the African-American community. I will say that children 5 to 11, they have a significant lower vaccination rate than adults, which tells me that a lot of the parents are still not vaccinating their children. And I want to encourage the parents to vaccinate the children, because the children, even though they tend to get milder illness, they can get COVID, they bring it home to you, and you get COVID, and you with underlying conditions end up with more severe problems.
That's okay, don't worry about it.
They end up with more severe illness, have to be hospitalized. So, you know, really want to put a plug for parents to make sure they vaccinate their children between 5 to 11, because the numbers are very low in that group. Now, to answer your question, the FDA came out last week and said they're going to wait before they give emergency use authorizations for the children less than 5, because the data that they have didn't show that there was a lot of benefit to giving the 2 doses. They have to wait for another set of data with giving 3 doses. Now, I tell everyone, I prefer them to take the time to wait, get that data, and present it before they make a decision. They're doing their job. They're making sure they look at every bit of data. And we've always said we want to trust the work that the scientists are doing. They are doing their job. Right now, they feel they don't have enough data to go ahead and give any approval. So they're saying, let us wait. So I think parents should feel reassured. I know that, you know, we're all hoping that we would have the children under 5 vaccinated, but there is a reason for it. And I think it's going to be for the benefit of everyone.
That's very good. But you made a point about encouraging parents. But what about these parents that are not vaccinated themselves? So, if you're a parent, you're not vaccinated, so there is no way you're going to have your children vaccinated. Donna, what you say?
Well, I've heard it both ways. Like some parents are vaccinated, but they want their children to be vaccinated because the children are in school.
Right.
You know, the parents are vaccinated and they just want to wait and see before they have their children get vaccinated. So it really is an individual personal decision. And I think the more we can just get the facts out there to help people make informed decisions, so that they're not relying on, you know, the misinformation and conspiracy theories. I was just speaking with a young woman just a couple of days ago who said one of her main concerns, she's not vaccinated, she's 20 years old, and Dr. Wild, she was saying that she thinks that there's some fertility issues with the vaccine, and she's very concerned about putting it in her body. Can you just talk to these young people and help them to understand the facts about that?
Dr. Bright, all the young individuals are concerned about fertility issues. And one of my main talking points, they have done numerous studies that show that the vaccines have no impact on your fertility. What we do know, and I have seen this so many times in the hospital, is those that are pregnant that end up with COVID really don't do very well. Most cases, they end up in the ICU, they are on a ventilator. And unfortunately, I've seen a few deaths of individuals who did not get vaccinated and they're pregnant and have very severe outcomes because of COVID. So I really try to encourage individuals to go ahead and get the vaccine, whether you are thinking about getting pregnant, whether you are pregnant, because you do not want to be that individual that has a poor outcome because you were not vaccinated against COVID. And it does not, based on all the data that I've looked at, there has not been any impact on fertility for those that are of childbearing age, and no impact on men also.
Mm-hmm. But like you said, Dr. Wiles, you know, some of it is just fear. And given the history, especially in the Black community, where we have gone through that Tuskegee, you know, fiasco, and, you know, people have kind of lost their way and have lost trust in the medical professionals, you know. And, you know, no matter how you try to explain to folks, you know, well, you know, it's a new day. I have a sister who will not, absolutely will not take the vaccine. And one of my questions to her is, because she said to me, I don't know what's in that. I said, but currently you're on medication. Do you know what's in the medication? And she couldn't answer. So, and for ages, we have been vaccinated. For those of us who are from the Caribbean, I don't know about people here, but most of us have a dime-sized scar on our arm from vaccination. So from the beginning of time, and I said, you know, we're getting these vaccines that we're not ending up with these things that is blowing off our shoulders, you know, you know, and leaving us with big scars. So, you know, what is it? You tell me, what is it about the vaccine that just really scares people to death?
You know, I want to say that, you know, the program that Dr. Bright has is really good because it's about building trust.
Yes.
It's about having someone there that can answer your questions, regardless of what the question is, right? So if you feel reassured about the information, I think you're a little bit more likely to get the vaccine. Mm-hmm. And I think what you asked your sister was a great point. You know, what do you know about the medication you're taking? Most people don't. And I always use this to point out, they have listed all the major ingredients in the vaccine. So for those who say, I don't know what's in it, I said, I can print it for you. I can show you the website so you see all the things. So using that an excuse is not really something that I'm going to say you get a pass on, because the information is there. I think bottom line, people are just fearful and they don't trust. One of the reasons people tell me they don't trust it was too fast. They just never seen vaccines come to the market. And we haven't seen that because we just never were in that particular crisis situation where we needed to all work together, pool all the funds. So, you know, that is why we were able to get the vaccine so quickly, which I can't tell you how grateful I am for the vaccines and for the booster, because a lot of lives have been saved. So, you know, I mean, I think just having the conversation over and over again, hopefully that will make an impact. The thing that I always see is when there's death and dying and it hits closer to home, that's when people want to take the vaccines. And I'm trying to get people, don't wait until you get to that final hour. Let's do everything ahead of time to protect yourself and your family.
And I think too, oh, sorry, Pastor E.
So many cases of this where people who decide they didn't want the vaccination, they end up in the ICU and, you know, they're begging. How sad is that? How sad when you as a physician have to tell someone, I can't give you this now because it's not going to help you. How sad is that?
I mean,
so your job is hard.
Yes, it's very painful. It's very painful to see that, and which is why having this forum where we can talk to people ahead of that situation, because a lot of times it's a little too late to beg and plead for the vaccines because there's not much more I can offer.
Right.
And the thing, the good thing about being at this stage of the pandemic is that we have a year's worth of data that on the vaccines, and not just in the US, but all over the world. And so I don't know if there's, you know, any, we know that the vaccines are safe because we have so much data now that demonstrates that. And so we know people can die from COVID, but we know that the vaccines, I don't know that anyone's died from the vaccine ever, if there's been a case of that. And so clearly it does prevent, it's also very effective, not just safe, but effective in preventing severe disease, hospitalization, and absolutely death. So the people who are in the hospital now dying are overwhelmingly 90 some odd percent are unvaccinated. 90, is it 98 or 97? It's really high. They're unvaccinated who are in the hospitals and who are dying. So there's just, like you said at the top of this, Pastor E, I don't know who else is out there that needs more information and evidence of how effective these vaccines are and how deadly COVID-19 can be. Yeah.
You know, and I guess I can be a little biased because I had COVID-19. So when the opportunity came for me to get the vaccine, it was not even a question. There was not even a question in my mind because, you know, of the severity of the disease. I mean, at least I was out of work for about a month.
Wow.
And so when they said, you know, CVS is coming to work with the vaccine, the only person that was in line before me was the administrator. I was right behind him.
Good. Yeah.
You know, because I was so grateful that there was something out there because you know, the way I was sick, I said, I don't ever want to be sick like this ever again. You know,
yeah.
So unfortunately, folks, if it doesn't hit home and hit really close, or you know, them going through it, it doesn't faze them. You know, they can live life and go ahead and I'm good, you know, and all that stuff. Now we are winding down, so I'm going to give you guys the last word. Whatever you want to talk about in your last You have 5 minutes, Dr. Wiles, and you got 5 minutes, Miss Donna. You talk about whatever you want to talk about with the successes you've seen in the Black community, whatever you want to talk about. We're just going to wrap this up.
Okay, I don't mind going.
Okay.
First. Well, I just want to say that I'm really just so excited and really impressed with how the Black community and the Black church in particular just really have rallied around these issues and stepped up to not only feed the people who were experiencing a lot more food insecurity with the COVID, with the pandemic, with lost employment, but also really trying to be a leader to promote the vaccines. A lot of pastors stepped up and, you know, were being very public with their vaccinations and then preaching from the pulpit, whether it was virtual or in person, to really get the word out and motivate people to get vaccinated. And there have been several churches, Morning Star Baptist Church. I want to give a shout out to them because they set up a vaccine clinic early on and they're still going. So to be able to have a stand-up resource in the community, a go-to where people know, oh, I can go there to get a vaccine to this church is great. And a lot of the pop-ups have been good too. But the community health centers have just been a really important partner with the churches. They have been just so willing to get out of their comfort zone and come out of their clinics and set up clinics in the churches and other community settings. And so on next Saturday, on the 26th of February, we're going to have a pop-up at the Global Ministries Christian Church. It's in Dorchester. And the Dimmick Center is our clinic partner for that event. So they will be there administering vaccines and boosters. It's actually 12 and up, not 5 and up. They don't have the pediatric doses for this event, but the 12 and up can come and get your first, second, third booster shots. We'll be there at the Global Ministries Christian Church from 10 to, we'll probably stay until 1 if we get the demand that we are hoping for. So please come out and get your vaccine and get some, you will have some praise and worship for you too.
Are you doing boosters as well?
And boosters for sure.
And that's Reverend Wall's Church on Washington Street.
Yes, Reverend Bruce Wall's Church. On Washington Street. The number escapes me, I'm sorry. It's not far from Common Square, but yes, Global Ministries.
The Boston Praise Radio.
Yes,
Praise.
yes.
Yes.
So please spread the word and get vaccinated.
Yes. And I will definitely, because I use this platform. I don't have a building, but I use whatever platform I have to encourage people. You know, sometimes I think I'm a little, over there, but it doesn't matter. You hear it. I'm going to tell you, let's do it. Let's all get healthy. Let's get away from these masks. I'm a little weary. I want to show my face. I want to wear my lipstick. I want people to see my...
I know. See a pretty smile. Right.
I'm just joking. But Dr. Wiles.
So, I first want to thank you, Dr. E, for using this forum to get the word out. I mean, really important to educate our communities and for all the others who have been using similar platforms. And really the work that Dr. Bright has been doing,
Yes.
it has made a tremendous impact in the community. You know, I'm just gonna wrap up with 3 simple points. Vaccines and boosters, they're safe and effective. They save lives. I want to encourage those who have not made the decision to get the vaccine or to get their booster, try to schedule an appointment, because things are better, but we're not done yet. And we don't know what's coming next. And I want to make sure that we have all the members of our community being protected so that we can be around for all the parties and the graduations and all the weddings, right? We don't want to have to go to another funeral that was COVID related for someone who could have avoided that if they got their shots. Next thing I want to talk about is that, you know, we have made all the progress of vaccines, but the good news is that we have now oral antiviral therapy that you can get for treatment if you have COVID. So you have to make sure, though, that you're in contact with your primary care provider or healthcare provider. If you have COVID, and you let them know within the first 5 days, they have 2 new therapies on the market, Paxlovid and Molnupiravir, which the names are very complicated, but your doctors will know them, and they will see if you qualify for those drugs. And you know what? Those drugs are free.
Wow.
They are free. You don't have to pay for those drugs. In fact, they will send the prescription for you to Walgreens, or they have different sites called the Gotham sites located in different areas that you can just go and pick up your drug, and it makes a difference.
Wow.
I have used it and it makes a difference. So, you know, things have really worked a lot better now if you have COVID versus, you know, a year or 2 ago when we didn't have oral antiviral therapy. So, you know, making good progress. So I don't want people to think if they have COVID, you know, they just have to stay home and suffer. We do have oral medications. And the way I tell patients, just like when you have the flu, you can go to your doctor and you get Tamiflu. It's the same way we're progressing with regards to COVID. There's also another medication which people might have heard about, is monoclonal antibody, where you get an infusion. It's an IV infusion where you have to go to specific sites, and your doctors will know the different places that you can go to get it. But again, just other options that we can use to help to treat COVID. Not in place of vaccines, but, you know, additional therapy that we have to make sure everyone can get through this as healthy and as quickly as possible. So, you know, again, just remember, you're not alone. We have to take care of each other, be your brother's keeper, take care of yourself, and also take care of those around you. And thank you for having us.
Yes, thank you.
And I have learned a lot, because I didn't know anything about those antivirals. I mean, so now I could spread that word too. You know, it's amazing. Well, ladies, it has been a pleasure. And I'm hoping that I could get you guys back at some point, because this was amazing. I thank you so much for taking time out just to be here. I know you guys are really busy, but this was important enough to you that you took time out. And so I thank you from the bottom of my heart. I'm very grateful. And I know that our listeners are grateful for the information that they've gotten. Some old information and some very new information. So thank you, thank you, thank you.
And thank you
until next week
for having us.
Thank you. Until next week at 3 p.m., this is Pastor E saying, may the Lord bless you and keep you. The Lord make his face to shine upon you and be gracious unto you. The Lord lift up his countenance upon you and give you peace. Just remember that Pastor E loves you, and we'll have Moments with Pastor E next week again at 3 p.m. on Saturday. So thank you, ladies. I really, really appreciate you being here. It was awesome. Thank you.
Thank you.
Thank you.
All right.